Hi, I'm Cheryl Drake Bowers, and you're watching the second video in a series on self-treatment for the mouth and jaw. And if you have not watched the first video, I do recommend that. Won't spend as much time in this video and subsequent videos going over the details of the how-to. I'll just kind of go right to it. So you might want to catch that if you're wanting to follow the series. This is an appropriate series for anyone with pain in the mouth and jaw, or possibly for migraines and headaches. It might be very relevant, or neck difficulties. So I hope you'll enjoy this. So today we're going to look at the floor of the mouth and the tongue. So we'll be treating in this area under the jaw from outside the mouth and from inside the mouth. And then we'll also treat the tongue, which is sometimes forgotten, but the tongue is very muscular, very vascular, and there's a lot that can be happening there. So if you just look at the skull, you'll see where we're going to go. So we looked at this before, the mandible in the first video. We talked about the anatomy of the face, and in this case we're going to have a finger across the body, as we did before, up under into the soft tissue under the jaw, and with the other hand we'll go through the mouth, and we're going to try to find a way to have those fingers meet in the middle. And our treatment, much like we had in the first video where we had one hand on the outside of the face and one hand on the inside, stretching the fascia on the outside of the face, in this case we'll have that same concept, reaching in through the mouth and up through the bottom of the soft part of the underneath of the jaw to treat the floor of the mouth. There are a lot of muscles and things happening there, and then finally to treat the tongue. Begin by reaching across the body with the opposite index finger and hand into the mouth, inside the teeth in the floor of the mouth. The outside hand index finger reaches underneath the jaw. I'm exaggerating here so that you can see a big movement, but in reality that treatment would be slower and more specific. But you can see the demonstration gives you an idea of where you're going with that pressure. So your underneath index fingers are reaching up into the floor of the mouth to find the index finger inside. And you will find areas of sensitivity. And when you do that, you can stop and wait and take a breath. You can also find an area of sensitivity or interest, and holding that area between the inside hand and the outside hand, you can move those 2 points of pressure against each other, feeling through into the soft tissue in the floor of the mouth. When you find a barrier, you can move around it. And when you're doing both of these sides, here's an example of how you would find an area. Let your two treatment hands be fixed as they just kind of hold a space, and then you begin to move your head, your eyes, your neck around that point. In particular, areas of sensitivity or interest. You can open and close the mouth. You can tilt the head up a little to the side and then the other side. And you can wait. Both index fingers can go into the mouth at the same time on either side, and feel into the bottom of the mouth. You'll start to find the base of the tongue. There'll be a natural barrier on either side where you can just lean back and forth. Your fingers aren't sliding around in the floor of the mouth, they're sort of stretching the base of the tongue. And you can hold that and move the head around it. or also in this case, just doing one side at a time. When treating the tongue, you're going to want to have a little bend there in the index finger. So you reach into the back, towards the back of the tongue, and just bend that last joint of your finger and press down gently into the surface of the body of the tongue. And do one side, take your time, do the other. You can hold a place on the tongue and then move your head around it. You can also take a movement that we call stripping. So you just let your index finger begin in the back with that little hooking motion and just pull forward across the surface of the tongue to the front, covering the whole surface of the tongue. This is a demonstration of the original technique, but done a little differently. In addition to the way we first saw it, you could use a thumb underneath with the flat of your hand relaxed against the side of the head. And that thumb underneath is reaching and searching for the index finger inside the mouth, feeling through the tissue again. Here's another option for the same general idea. You can use several fingers at once on the outside of the face, up under the jaw, and have a broader point of contact, reaching and feeling through the tissue for the index finger on the inside of the mouth. There's a thumb. In this case, you could rest your elbow on a surface that's very comfortable and feeling with the index finger in the mouth and the thumb reaching underneath as they feel for each other through the tissues. Again, moving the head. Here's a close-up image to show you where you're going in the mouth, inside the teeth, down into the base of the mouth.